Hello again, everyone. I'm Mark Mazzaferro, Communications and Media Officer for the City of Vacaville, and we're here again with our live update on the COVID-19 situation here in our community. And with us, as always, Fire Chief Chris Concepcion. Chris, how are you today?
I'm wonderful, Mark. Good morning. It's a little earlier than our normal updates, right?
Yes, well,
Yeah.
City Hall's closed on Fridays, but
Yes.
closed, but we're still here working.
We're here.
You know, crisis or not, I guess.
Yes.
So let's start off with the number of cases, because those numbers have changed.
Yes,
No
they.
surprise there.
Luckily, from Thursday to yesterday afternoon, there was 3 additional cases in all of Solano County, so a total of 115 cases. Fatalities still at 2, which is good. And then as far as Vacaville cases increased from 18 to 20 yesterday. So we have 20 cases in Vacaville now.
Now, I really took a good look at the county site that has the numbers broken down for us, and I noticed that they have it broken down in terms of total cases, but also age group and severity of the cases.
Yes.
Which I found very
Yeah.
interesting.
Yeah.
In that just because people are testing positive for the virus and may have symptoms, there's degrees of symptoms as
Yeah,
well.
so happy to report that on there, if you take a look at that website, most of the cases here in Solano County are actually non-severe.
Right,
Yeah,
right.
so that's a good thing.
With a few hospitalizations.
Yes.
And again, you know, as soon as we start talking about numbers, the conversation switches to, well, they're not testing everybody, and
Right.
everybody that wants a test can't get a test,
Yeah.
so on and so forth. So what good are the numbers?
Yeah.
So what good are the numbers then?
Well, I mean, they're as good as, as far as the number of people being tested, and we're right now, as you said, there is a shortage. There continues to be a shortage of tests, really nationwide, but here in the state of California, we do have a shortage of tests. So they are only testing those people that are symptomatic, and the testing that they're doing right now, there's a lot of questions as to, why aren't we testing everyone? Whether you have symptoms or don't have symptoms, why aren't we testing everyone? Well, the number one question or answer to that is there's a shortage of tests. And then the testing that they're doing right now is what they call RNA testing, which is they're testing you, they do a nasal swab to see if you have any of the virus in your body. So you will only test positive if you have the virus right now. And so that gives you a snapshot in time. So as you and I were talking, the other day, is you could test negative, with this RNA test right now, whether you have symptoms or don't have symptoms. But then the next day you could get exposed and then test in a couple of days, and then you test positive. So it really only gives you a snapshot in time, if that makes sense.
Yeah, and the idea that I don't know that it would be practical to test everybody anyway. Why would you want to do that?
No, it wouldn't be. I mean, I know a lot of people want to get tested.
Yeah.
They just want to know, do I have this thing or do I not have this thing? And really, we're only testing, they're only testing people right now when there's an action that can be taken or a decision that can be made for that particular person.
Right.
Because of the shortage of tests.
So, and even, I'm hearing that people are going to the hospital, they are sick, they won't test them. They're telling them to go home and, shelter at home and take care of yourself,
Yes.
which is good advice.
Right, yeah, absolutely. I mean, it's kind
you're-
of the same
you're-
thing that they do for the flu, right? Yeah.
Right. I mean,
Yeah.
you're sick, so whether you have COVID-19, the flu, or whatever, you still need to go home and shelter in place and maybe self-isolate and take care of yourself.
Yes, absolutely.
All right. We could go on and on about testing, about the antibody testing.
Yeah, so that's the thing that's coming up. And I do want to tell everybody, though, that there's an FBI warning out there that there are some scammers out there that are putting out these tests. They're home, they're saying that these are home tests and all that. Right now, be aware of those. That is a scam. There is no such thing as a home test. I mean, if you're going to get tested, the testing that's out there right now, if you're going to get tested for COVID-19, it has to be through a physician's order. And again, right now, here locally, we're only testing those people that are symptomatic and through the hospitals.
All right. Now, the big news coming out of our most recent briefing this morning is that we're going to be closing Lagoon Valley Park over the weekend. Let's talk about
Yes, I know, long conversation at this morning's incident briefing about closing Lagoon Valley Park. And we hated coming to that decision, but that's the decision we're going to make. We've got a few things that are happening this weekend. It's kind of a convergence of in the fire service, we call it everything coming into alignment, right? Mm-hmm. And so we've got what looks like to be good weather. It's supposed to be sunny in the mid-70s, which is, a perfect spring day here in Northern California. You have Easter, and then you have, just a perfect day to use a park. And so, and then we also still have folks that, even though we're trying to keep the parks open, they're still not complying with that physical distancing that we're asking for. So that's why we arrived at the decision that we're going to close Lagoon Valley Park for the weekend. And we realize that just creates all kinds of inconvenience for everyone. But we're getting to, we're effectively flattening that curve. And by all indications, from everything that's coming out, we're approaching that peak. And so it's very, very important that we stick with that physical distancing that we've been asking people to do.
Yeah, I mean, part of what we've seen also is that as all the county regional parks are closed.
Yes.
And then some of the other cities have closed their larger parks, and that's because we haven't. People are coming to Lagoon Valley and taking advantage of that facility. Yeah, it was one of the things, we were one of the last ones, right? And so what happens is, as you close the county parks and then you close some of the other city bigger parks, that just pushes everybody to the parks that are not closed yet, and so that's another factor that we weighed as far as our decision to close Lagoon Valley. And while it was certainly discussed today, the whole park situation is an ongoing conversation at our daily briefings. What to do, asking people to comply, et cetera.
Yeah, we monitor the situation very closely, and because we realize how much of an inconvenience this is to everyone. I mean, this is not normal. I mean, we are normally encouraging everyone to go out to the parks and go play, get some sun, right? Mm-hmm. And we're doing the exact opposite here. So we realize how much of an inconvenience this is causing everyone. The one thing that I do want to mention is, we zip-tied the basketball hoops, and we've taken down the tennis nets, and yet now we're getting reports of, and then we've also put the snow fencing around some of the playground equipment at some of the higher used parks, and we're getting reports that some of the zip ties are getting cut, as well as the fencing is being removed. We're better than that, aren't we, Vacaville? I mean, we can't do that. I mean,
you like to think that it's a simple request is easy to follow, but not all the time, apparently. Yes. I'm kind of speechless at that one.
Yeah, I'm just imploring the city that we didn't make that decision lightly. It was a long conversation with a lot of input, and we realized how much of an inconvenience it was going to cause. But please, Vacaville, help us. Realize that we zip tie this thing, the basketball hoops, and then if someone cuts those things and then risks others by not having that physical distancing, our staff is going to have to go out there and just redo it again. Mm-hmm. And so please help us by number one, not doing that, and number two, continuing to comply with the social physical distancing that we're asking.
Yeah, it's a simple request, and hopefully the message will sink in at some point.
I'm sure hoping so. You know, the one thing that I am encouraged by is since last Friday afternoon when the cloth face covering directive or guideline came out from the CDC. As I'm going around the city, I am seeing more and more people complying by that, so that's a good thing. Especially, you know, just a reminder that especially in areas, I mean, you don't have to have it on all the time, but especially when you're not at home, you don't have to have it on when you're at home, but certainly when you're outside, it's a good idea to have it on, and it's absolutely imperative to have the masks on when you are going to the pharmacy or to the grocery store, when you know you can't guarantee that you're not going to come within, you know, less than 6 feet of somebody else.
Right, just so you know, I have my mask.
I've got
here.
mine back there.
I keep it with me at all times. It's my constant companion now, and it will be for quite a while.
Yes, it will be. It will be.
All right, anything else you'd like to add, Chief?
No, just everyone, wishing everybody a great weekend, and happy Easter out there. And, you know, stick with us or bear with us as we go through this stuff. We know we're going through some tough times, but we'll get through this.
Right. Listen, if you want more information about what's happening in the city, the state, the nation, please visit our website, cityofvacaville.com/COVID-19. And if you have any questions or concerns, feel free to send us an email, cinfo@cityofvacaville.com. Thanks for watching, everybody.